previous presentation, I said are usually conducted every 2 years. And then we also conduct previous health risk assessments that were conducted by ourselves, or sometimes in other cases our predecessors. The important part of health risk assessment also is to anticipate what you are going to find once you walk inside or into the factory or into the workplace. It's also important to choose your team very effectively. You need to have somebody that will be able to explain what's going on in the factory, meaning you cannot just go in as a healthcare provider or as an occupational health clinic team, being the doctor and the nurse. You need to have somebody that will be able to answer the questions on the spot. It can be part of management. It can be part of the occupational health and safety team. Basically, somebody that understands better what's happening inside. Remember, you do go inside the factory or the workplace, but it's not your usual place of work. So there are many aspects of the environment that will not be familiar to yourself. And then again, it's very important to do your research, because there are certain hazards that are known to exist within the industry that might not necessarily be prevalent in the environment that you are assessing, but are known within a certain industry. And you need to go in with the knowledge of all these hazards so that you are able to perform your duties with all the ammunition you need. Next slide, Doc. Okay, and then the next stage is executing the actual health risk assessment. Firstly, you need to be able to identify the hazards, meaning you need to understand them. And this is the stage where you're doing your walkthrough. You need to, like I've said, ask the people who know what's happening inside to be able to accompany you and explain. And then secondly, you need to learn to use all your senses. You need to be able to use your eyes to see what's wrong or what could potentially go wrong. You need to be able to use your ears to determine whether the noise is too loud or not loud enough. You need to be able to use your nose to smell the fumes that you encounter in the workplace. And you need to be able to sense with your skin what's too hot, what's too cold, what's warm. Hazards such as humidity, you need to be able to determine all this through your senses. Most of the times, because we perform what we call qualitative risk assessment, you don't have tools, to measure noise or to measure the dust particles or to measure the amount of light within the environment. You would have interacted with these reports from the occupational hygienist before you go in. So you go in with a knowledge of what to expect inside. And I think it's worth mentioning that amongst all your senses that you will employ once you are inside, there is one sense that should remain inactive. You do not taste anything once you are inside. And then the other important aspect is the exposure part. Remember, by doing a health risk assessment, you are also exposing yourself to the environment. If it's too hot, you're going to experience the heat. If it's too loud, you're going to experience the noise. So you need to be able to consult the health and safety team about how to protect yourself. You need to have proper PPE going in. You can't just go in with shorts and slippers because you just want to see what's happening quickly. You need to be properly dressed. You need to be properly protected. Next slide, Doc. And then in terms of hazards, we have indicated in the past that we have 5 different types of hazards. We have physical hazards, which have a potential to cause a physical harm or trauma to the body. We have chemical hazards, which could be either be inhaled, absorbed through skin contact, or ingested, either intentionally or inadvertently. And then we have biological hazards that we said. Biological hazards are any pathogenic organism that you might encounter in the workplace, including flu, including COVID-19. Any microbiological organism that you might encounter, be it a bacteria, virus, fungus, protozoa, anything that might cause an illness, and sometimes even things such as radiation. Then the next group of hazards is ergonomic hazards that you encounter through interaction with work. You remember 3 cycles that we spoke about earlier. This will have impact on your musculoskeletal system and sometimes push the body to the limit. And that interaction or the response of your body towards such an interaction will lead to ergonomic conditions. And then lastly, as they say, a happy workplace is a peaceful place. And obviously that's underrated because there's so much that goes on in the workplace. You'll have issues such as stress, difficult colleagues, difficult bosses, sometimes, salary issues, anything that has a potential to affect your mental illness within the work environment is considered a psychosocial hazard. Next slide, Doc. So in terms of physical hazards, we did indicate that anything that could, and there are many different scales used within the occupational health environment. And the scales could range from anything from very mild to very severe. You'll have mild, you'll have a moderate risk, you'll have severe risk, you'll have very severe risk. And often very severe risk is what will lead to death. If you look at our picture there, you have little John with high probability of walking into the trench with low impact because the trench is shallow, and that will lead to a mild to moderate hazard or risk. And then on the next frame, low probability of walking into the trench with low impact, meaning a very mild risk. And then low probability on the next frame and a possibly high impact, leading to mild risk because it will still be possible for him to just jump over. But for instance, the process of risk grading or quantification is very dynamic and it depends on various factors. If, for interest's sake, we said that John was drunk, the risk will significantly increase, although he is the same person under the same circumstances. The only difference is that in this case, he is drunk. He might fall into the trench despite being narrow and him being able to jump over it. And then lastly, on the last frame, we have a high probability and high impact situation where no matter what he does, he is very likely to end up in there. And on the next slide, we have what we call a risk matrix. And on the risk matrix, remember we said we have impact and the consequence. So the consequence and the likelihood. So we balance the probability and the consequences there. Under consequences on this particular risk matrix, and remember I said there are different matrices being used. When the probability, the consequence is very minimal, like little or adverse effect, little of, if any, adverse effect could happen, we usually score it 1. When non-life health-threatening health effects that would require on-site first aid happen, we call it, we score it 2. And when serious adverse health effects happen, we will score it 3. And normally this will require off-site medical treatment. And lastly, if we have serious long-term or even